You're welcome back to the show. Many thanks for staying with us. Well, it's something that has for weeks hunted students and authorities of Kumasi Academy. 4 students have died within 3 weeks, and what some parents have speculated to be poisoning or ritual killing. But today, health officials have pointed to the ever-deadly meningitis as the cause of the strange deaths at the school. Today, an emergency response is underway. Head of the Ashanti Region Security Council, Simon Osei-Mensah, and health authorities have been addressing the media in Kumasi. Kwesi Deborah was there for us, and he joins us on the line right now. Hello, Mr. Deborah.
Yes, guilty.
Yeah, first, do we know which strand of meningitis we have in this particular outbreak?
Okay. The regional minister at the beginning of his speech spoke about meningococcal meningitis, which is a harsher form as compared to pneumococcal meningitis, which we were told. But the medical experts from the regional health directorate told me off record there's a likelihood of the meningitis turning out to be pneumococcal other than the meningococcal. So a bit of variance there between the speech by the minister and what I picked from the medical experts around. But the baseline is meningitis. And they inform us that they have sent tissue samples to the Noguchi Memorial Institute for Medical Research to ascertain the bacterial strain.
So there's obviously the chance that this will spread. We've seen 4 people die. Obviously, it spread from one person to the other 3.
Yes, he said there have been seasonal reports of meningitis in Ghana, normally during the dry period of October to March. But reports of 1 or 2 cases do not constitute an outbreak. That's what he said.
That's what he's saying. But we're looking at a school where people are come into close contact with one another, and we're looking at a number of them as well. If you have a contagious disease, it is not advisable to keep students in school. Did they say anything about whether or not they're keeping them?
Okay, the headmistress told us of a certain yet to be completed edifice in the school, and they are planning to send the walls, that's the students to their place because of the congestion. But there aren't any plans. Terminal exams are supposed to start today, but we are learning that they have been put on hold, and most students aren't also in school because of the threat. But they never hinted of such plans.
Okay. We understand that there have been some advice to the public about how to prevent death if people are already infected. Can you take us through that briefly?
Okay, according to what I picked from the medical experts, it says if you experience symptoms such as headache or malarial symptoms, just visit the nearest health facility. That's all.
Hello?
Guilty?
Yes.
Guilty. Yes. As I said, that when you experience, that's what they told us, when you experience symptoms such as headache or malarial symptoms, just visit the nearest health facility or the nearest hospital. Yeah.
All right. Well, hold on for me, Deborah, because he also spoke with the regional minister. We can take a listen to the regional minister, and then I'll come back to you and we wrap up what's happening on this particular case in Kumasi.
Interventions that have been implemented at the district, regional, and national levels. Meetings of the district epidemic management committee involving all other key stakeholders. Meeting of regional technical coordinating team. Field investigation to establish the cause of death by team made up of district, regional, and national personnel. Autopsies of 3 bodies at St. Patrick, St. Michael's Hospital, and School of Medical Sciences. On the field orientation of health staff, identification of contacts and follow-up, laboratory testing of all samples to get the causative organism. Next steps, that's the steps that the Ministry of Health is going to undertake. Urgent meeting of the Regional Epidemic Management Committee. Designation of hospitals for all senior high schools, which means that each senior high school is going to be allocated with a particular hospital. Orientation of all medical superintendents, doctors, physician assistants, and prescribers on meningitis. Massive awareness of the general public on meningitis and other epidemic-prone conditions. Intensification of surveillance at all levels, including private hospitals in the entire region. Strengthening collaboration between GS and Ghana Health Services to ensure the health and safety of all people and students. Expectation. With the increasing awareness, we expect increasing reported cases due to improved reporting and high index of suspicion on the side of clinicians.
Well, that is the regional minister there. Very soon I'll take you through quick information about meningitis, what you need to know, what the causes are, and how it actually spreads. But Kwesi Deborah is still on the line with me. He covered that press conference. Kwesi, what are some of the parents saying about this situation?
Okay, first of all, let me start with the students. I spoke with some of them, and they are palpably afraid and in some kind of a dilemma as to what to do. And some also said they are trusting the school authorities to bring the situation under control. The parents, I wasn't able to spot some of them in the press briefing, but I was able to locate one who was speaking to an authority, and he was asking the authorities that they are just wondering when to bring their wards to school, because they are not so sure of the interventions that have been put in place by the regional health directory. So they are just asking. They are a bit of like the students are in a bit of a dilemma as to what we do. Simply.
How has this created any sort of panic, would you say, in the neighborhood, in the community where the school is situated? Because we know that this is obviously a contagious disease.
Yes, I spoke with some of them. I spoke with the residents, those who live around Kumasi Academy. They obviously are not so much aware. Most of them are not so much aware of how what the disease is. But definitely, they were a bit of anxious as to what to get to know the real situation on the ground. So the DS is more of anxiety. Wants to know more about the disease and how it's spreading.
How it spreads and what this disease is all about. Thank you very much, Kwesi Deborah, for that. But let me just take you through some of the information that you need to know about meningitis, basically. Well, it is a serious infection, but a serious infection of meningitis affects the brain membrane. It can cause severe brain damage, and it is fatal in 50% of cases if it is untreated. There are several different bacteria that can cause meningitis, and the Neisseria meningitidis is the one with the potential to cause large epidemic. It doesn't appear from what Kwesi Deborah says that there is any, it doesn't appear that there is that kind of outbreak at this moment. Let's talk about transmission now. It is transmitted from person to person through droplets of respiratory or throat secretions from carriers. So you're talking about saliva, you're talking about phlegms, etc. It can be transmitted through that. Close and prolonged contact, such as kissing, sneezing or coughing on someone, or living in close quarters, such as dormitory, sharing eating or drinking utensils with an infected person, facilitates the spread. So you're obviously looking at a school where you have a lot of young people who are very interactive with each other, and so this is obviously a problem in that particular, in that sense. So these are just a few information that you need to know about. I've got a third one actually, well, on the transmission, by the way. Well, the average incubation period is 4 days, but it can range between 2 and 10 days. The bacteria can be carried in the throat, and sometimes, for reasons not fully understood, it can overwhelm the body's defenses, allowing infection to spread through the bloodstream to the brain. And we're dealing with the brain here, and that's why you can record all of those fatalities where you have people dying, etc. Symptoms, briefly: you have a stiff neck, high fever, sensitivity to light, confusion, headaches, and vomiting. Even when the disease is diagnosed early, you still see some of these symptoms, but it's obviously a treatable disease. Well, finally, about the symptoms. Oh, well, that's it for the symptoms of meningitis. Some information that you need to know, quite important information. I didn't know a lot about this before today anyway. You're still here with me, Gifty and Rapia. The show is The Pulse. Let's move on for meningitis now. The European Union has committed 700,000 euros to assist deprived communities in 2 regional capitals, Greater Accra and the Bono Ahafo region. The grant, according to the head of governance at the European Union in Ghana, Maria Luisa Troncoso, is to support vulnerable groups, especially women, youth and disabled, with a source of livelihood. She tells Joy News that after the launch of the project on Wednesday, this is also expected to enhance economic growth of Ghana.
Mainly the activities that are pilots is revenue mobilization. That is an important part for decentralization and to empower communities.
So who is your target?
Our target will be women, youth, job creation for youth, women, association of women, disabled people.
And how exactly will you be helping them?
We're helping on job creation, will be also capacity building, trainings, vocational trainings, and creating economic resources for small, medium enterprises.
I'm glad you talked about small, medium enterprises. Are you going to assist them learn a skill, a trade in any way? Is that how you're going to do that?
Yeah, a big part will be training, vocational training in the project, and will be implemented by ActionAid.
How many people are you targeting to impact their lives?
It is around 10,000.
What is the...
Indirectly will be more people, as all the families are also there.
Within what time span?
Yeah, it is from now that is starting the project until 2020.
So it's a 3-year project. Will there be monitoring, evaluation to ensure that all the projects you are putting in place follow through successfully?
Yes, this is one part of our requirements as European Union. We try to monitor regularly, in regular basis, in order to adapt the project in case it's not working or in case we are not getting results, and then to adapt also to the circumstances of the communities.
Country Director for ActionAid Ghana, Sumaila Abdul Rahman, says the beneficiaries of the project in the selected communities will be chosen based on their current employment situation. He asked that the municipal and district assemblies are expected to draw up programs to implement the project and also increase revenue mobilization.
We're going to pilot an e-revenue mobilization system, and we use the successes of this project to replicate in other areas and also to influence government policy, particularly around revenue mobilization.
How exactly will the revenue mobilization be done?
Yeah, we're looking at how we can use technology to enable taxpayers pay their taxes to the assembly. So we are developing the details of that.
What will they be doing to increase revenue mobilization? I want to know what the women, the youth and the disabled will be doing. That's what I want to know.
No, the women and the disabled people, they are going to be supported to carry out livelihood activities. So depending on their interests, then the project will support them, enhance upon that.
Such as which activities?
Like artisans, hairdressers. You know, we have some interesting component around people who have expressed interest in phone repairs, because now every village, you find that almost everybody has a phone. So
what will you be doing? You'll be giving them money?
Yes, we'll be giving them training, we'll be giving them startup money to set up shops so that they can do some of these petty jobs.
Hopefully those interventions reach the right people. ActionAid Ghana will facilitate the project, which is currently being implemented on a pilot basis. The coordinating director at the Medina Municipal Assembly, Saka Dramani, tells Joy News his expectation is to see residents in the community self-sustained and employed, unemployment reduced by the time that the project ends in 2020.
We have a responsibility in the first instance, identify who the poor and the vulnerable is, to assist them with funding. So at any given time, we have a responsibility to ensure that the resources are made available for the building of the capacities of the poor and the vulnerable.
What will be your criteria for selecting these people?
Yes, already we have database on who the poor is. We have registered groups, that is artisans. We have registered women groups within the municipality. We have registered persons with disability. If you go to social work, we have all these records. So based on the records that we have, that's what we're going to use to select who should be a beneficiary.
So when they come to you and they tell you they need a help, then what do you do next?
No, certainly if they say they need help, we have the social services subcommittee that goes in to see the background of the person. You know, you look at where he or she is. If that person is already working, you go and then you ascertain whether it is true or not. And based on that, once you are satisfied that yes, this is a person who is a needy person, then you can support that person.
But is it not something you already do as an assembly?
No, we are doing, but it's what we are doing may not be enough.
At the end of it all, what would you want to see different in your community?
Certainly based on the, you know, before the commencement of the book, you have to do what we call the baseline survey. So at the end of the period, we envisage to see people non-gainful employed being on their own and not dependent on government for employment. Self-sustenance. We want that at least most of the unemployed, they should be self-sustained.
Welcome. Today is the final day of the royal visit of Her Royal Highness Princess Anne, second daughter of Queen Elizabeth of England. Princess Anne, as part of her itinerary today, will be paying a courtesy call on the Asantehene Otumfo Osei Tutu. Will be going there live to speak with the Rastus Asari Donko, my colleague, right after this break. Please stay.